So are you happy, Owen, if I make a start?
Yeah.
Yeah. So I think we will make a start. We have had a few more people sign up. So we might get some people join us as we go on. But we also know that lots of people watch the recordings of the webinars as well after after the event. So I think we'll start just to remind people that we are recording the session so that people can watch it at a time that's convenient to them. So if you don't want to appear on the recording, please do switch your cameras off. We are delighted to be joined by Owain Johns, who is the service manager of Be Healthy Bucks, the free health and wellbeing service in Buckinghamshire, commissioned by Bucks Council and the NHS. And to learn more about that service, it's one of the most popular services in our rate and review section on our website, and we hear lots of positive feedback about it. So really keen to find out more about that. And I'm Zoe, I'm Chief Exec of Healthwatch Bucks. I'll be chairing the webinar. And we also have Fiona with us today, who leads on our patient and public experience work too. So thank you. Over to you, Owen.
Thanks for the lovely introduction, Zoe. So my name's Owain Johns. I'm the service manager for Be Healthy Bucks, an initiative that's commissioned by Buckinghamshire Council and delivered by Maximus UK. And I've had the privilege now of working in Buckinghamshire for almost a decade. And for the past 8 years, I've been a part of the integrated lifestyle service. So I've really been able to experience firsthand how the service has grown over that period of time, and also the impact that it's had on our communities as well. So today I'm going to be giving a brief overview of what we can offer, what we do, how we're tackling health inequalities, and the ways that we support residents to live healthier and more active lifestyles. So I'll also be sharing some of the outcomes that we've achieved, not just over the past year, but also looking at the last quarter and even the most recent month, just to give everyone a clear picture of our progress and also of where we're planning on going in the near future. So to give a broader picture of Be Healthy Bucks, it's what's known as an integrated lifestyle service, or an ILS. So these services are designed to bring together multiple strands of preventative health support all under one roof. And rather than treating issues in isolation, an ILS really looks at the whole person as well as the wider determinants of health. And the idea is that we provide an easy, joined up approach to tackling things like smoking, poor diet, physical inactivity, and alcohol consumption. And by addressing all of those things together, we can really support people more effectively as well as sustainably. And although Be Healthy Bucks is a universal offer that's available to all residents, a key part of our mission is to reduce health inequalities across the county, making sure that support reaches those who need it most. So I just wanted to use today as a bit of an opportunity to update everyone on how we've been working to close that gap, particularly in the areas that are facing the greatest challenges. So in Buckinghamshire, we have our Levelling Up wards, where residents are more likely to experience poor health, limited access to education or employment, and fewer life opportunities overall. And these are the communities where the work that Be Healthy Bucks does can have the greatest impact. So first and foremost, we take a place-based approach. So health inequalities are often not spread evenly. They're concentrated to specific areas. So we focus our efforts on where they're needed the most. So that means making sure that we've got service points and check-ins available in places like North West Aylesbury, Southwest Aylesbury, Chesham, and places in High Wycombe like Booker, Creswick, Castlefield, as well as West Wycombe as well. And we also work quite closely with our community and partnership team to make sure that we're also reaching other underserved communities too. Secondly, we build real relationships. So we know that people are far more likely to engage with services like ours when they know and trust the person that they're talking to. And that's why we have our community and partnership executives that work within Buckinghamshire to pull those groups into the service. We know that people who are out there building those long-lasting relationships with the residents of the county and local groups will really be able to make an impact on those people's lives now and also in the future. We also focus on hiring local staff as well that know the geography, and most of our team are either from Buckinghamshire or surrounding counties. So you also get to know that the person you're talking to likely knows the location that you live. Third, we tailor all of our services, so we don't believe in a one-size-fits-all approach. We base all of our support upon a personalised model of care, and we make sure that we're offering things in a way that people can actually access support, whether that's changing how we communicate, how we deliver services, or even just how somebody qualifies for the service. And an example of that is that our BMI threshold is lower for those in more ethnically diverse groups, because we know that they are more likely to be exposed to health risks. Fourth, we make all of our access easy. So we know that things like transport, digital exclusion, shift work can often be quite real barriers for services like this. So we offer all of our services in multiple ways: online, in person, over the phone. We also have WhatsApp programs that we run as well. And it's all about catching somebody where they're most comfortable and confident and willing to have that conversation about their health. We keep things flexible as well with our rolling programs. Most of our services operate on an open enrollment basis. So you could potentially come through to Be Healthy Bucks on a Monday morning for a GP referral, have a conversation with one of our referral team, and start a program at, I don't know, Hilltop Community Centre in High Wycombe on Monday evening. And finally, it's data to us is really important, and we really use it to guide us. So our opinion is if we're not measuring it, we're not using it, and we try to use the outcomes that we see through the service to then target different areas of the county, and that could be places that you live, that we could then come and actually support individuals within those communities. So let's get into the service offering now. And the first thing that you're likely to come into contact with through Be Healthy Bucks would be our referral hub. And for most people, that's going to be one of the most vital parts in shaping your journey with us. So this is our single point of access, and it's a centralized location for us to accept referrals and also to manage referrals. And we will contact you if you are referred to the service within 1 to 48 hours. Often it's a lot sooner than that, and you'll be welcomed by one of our lovely referral coordinators, either Liz, Michelle, Susie, or Alice, and they'll get to know you and your individual needs. They'll explore your motivations, and then they'll guide you through to the most suitable program based upon what you're most motivated to engage with at that moment in time. It's not just about signposting to us. It's about triaging you as an individual, understanding your lifestyle, your health, and also the wider determinants of your health as well. And this first conversation is a real chance for us to plant the seeds of motivation into you, to get you to start thinking about change. We also follow up as well. So we don't just support you once and then say goodbye. It's all about getting you to really trust the service and to continuously come back to us if you need additional support. So it's not it's not a one and done. It's a case of you can actually come back and use Be Healthy Bucks multiple times for different parts of the service. So really, all of that to say, it's not about quick fixes. And I think when you contact the service to begin with, it can sometimes be a little bit intimidating, but actually we've got a really lovely team on the phone, whether that's you sign up online or you actually ring us directly. Somebody will talk to you and run you through everything that's available. We have our adult weight management program, and we've really designed this to be as accessible and flexible as possible. So all of our programs for adult weight management, except our one-to-one groups, they run on an open enrollment basis. So as I mentioned in the previous slides, you could be referred on a Monday morning and you could access a program on a Monday evening. And that means that we can really capture you whilst you're at your most motivated. We've gotten rid of the traditional format in running these types of programs, which would be on a block rotation, which could often, that could leave you waiting 2 to 3 months before you actually start a service, because we understand that actually when you want to change and you need that support quickly, and you don't want to be put onto a waiting list. All of our services for weight management are available either in person or online, and we've got lots of different locations to suit different needs. So we've got different venues throughout High Wycombe and in Aylesbury. We've also got a session that runs in Chesham as well. We've got a session that runs in Buckingham, and we're also looking at other locations as well. And I think the really good thing about our service is if there's a need in a location for us to go and support, we'll do everything that we can to get there and to offer that and to get ourselves established. The criteria for the service, it's for anyone that's 16 plus, and we'll come onto our family weight management services in a little bit, and with a BMI of 30 plus or 28 plus for ethnically diverse groups or where comorbidities exist. And I also think it's really important that we share our outcomes and we're transparent about them to give people confidence in the work that we're doing. So between April 2024 and April 2025, 1,140 people completed one of our adult weight management programs. 843 of those achieved a 3% weight loss, and then 612 of those achieved a 5% weight loss. So it really evidences that the work that we're doing is supporting people in making those changes. I think it's important to mention as well that a large proportion of those people come from backgrounds of people that are affected by obesity, such as those with comorbidities, type 2 diabetes, hypertension, and other cardiovascular conditions. So we're really trying to get into those groups of people that need it the most. We then also have our family weight management program offering, and this is all based around building lifelong healthy habits with families. It's interactive, it's family inclusive, and it's led by nutritionists as well as personal trainers. There's a lot of behavioural science that's gone into this part of the service because we really want to get those long-lasting changes instilled within the family. So we focus on things like balanced eating, being more active, and also boosting confidence and positive role modelling with parents as well. We get families cooking together, playing together, and also just learning together about making healthier choices. And the really good thing about this part of the service is that once a family is completed, they can then continue to come back to the physical activity part of the programme in the future. We currently run these programs in Aylesbury and High Wycombe, but we also have an online offer for these as well. So you can access them anywhere, anytime throughout the year. The criteria for this is a child anywhere between the ages of 7 and 13 and with a BMI over the 91st centile. If you're aged between 5 and 7, you can also come through the service. You won't be able to access this program, but we can send you resources. We can still have a conversation with you. And once you turn 7, we can then get you enrolled onto one of our programs. So between April 24 and April 25, 202 families throughout Buckinghamshire attended our programs, and 100% of those that completed either maintained or reduced their BMI Z scores. So again, it's an effective program, and we're seeing a lot of long-lasting change with that as well. And families regularly come back to us to update us on what they've been doing since they graduated. And as I mentioned, some of those families still attend the physical activity part of the session as well. So we get to regularly catch up with them and see how they're getting on. So we then move on to the stop smoking part of the service, and we've really built our smoking service around one key principle, and that's just supporting people whilst they're their most motivated to quit. As an ex-smoker myself, I know that motivation can be quite fleeting. So when you want to quit, you want a service to act quite fast. So as soon as somebody's referred in with our stop smoking service, we'll typically contact you within 1 to 24 hours, if not the same day. We've got lots of different flexible communication methods for this. We can support you over WhatsApp, telephone, email, or text message, or we can also support you in person as well. We've got clinics that run throughout Buckinghamshire, and the goal really is just to get you started as quickly and as comfortably as possible. We'll come up with a quit plan together with you. We'll get you your nicotine replacement therapy or your reusable vape products delivered or given to you in person. If we deliver them, they arrive within 48 hours. So there's not any delay in actually starting that journey. And again, that really ties in with how much the team understands the importance of getting that support whilst you're your most motivated. So our support includes one-to-one coaching, real-time goal setting, and also benefit tracking as well for things like finances and the money that you save throughout, and things that change with your health quite quickly through your quit journey. The free NRT, nicotine replacement therapy and vapes, lasts for the full program. So that's 8 to 12 weeks of completely free support and product. And we're also preparing to introduce varenicline as well, a new stop smoking medication, quite soon. And I think with the stop smoking service, it's important to mention that I think the new national data says that it can take anywhere between 6 and 30 times to actually achieve a successful quit. So just because you come through us once and you try to quit and maybe you then go on to smoke again, it doesn't mean that we can't help you. We'll support you as many times as it takes to eventually kick the habit. And between April 2024 and April 2025, 1,036 service users actually achieved a 4-week quit with Be Healthy Bucks. So that means that they were smoke-free for 4 weeks, and 100% of the people that started a program with us were contacted within 24 hours of the referral. We also have the ability to come and attend different events throughout the county. So for people that are maybe watching this, that might not seem that relevant, but it might be if you're part of a club or a group and actually you've got people that attend that you think could benefit from Be Healthy Bucks. We can get one of our coaches or one of our community marketing executives just to pop along and say hello and have a conversation with you about the different services available through Be Healthy Bucks. We can take you through triage assessments on the spot and get you started with one of our services again very quickly. So if anyone does have an inquiry, there's contact at the end of the presentation that you can always just drop us an email on, and we can have a look at coming along to support one of your groups. We've also recently partnered with Aylesbury United Football Club, and this is part of a broader piece of work where we're trying to invest back into the social value parts of Buckinghamshire and give back to the communities. It's a really important piece of work that we're going to continue to expand on. And Simon and Dave over there have done a fantastic job at helping us get that set up and really pushing the information that we can support their club supporters and also staff and the team with the services that we can offer to different people throughout Buckinghamshire. We also have our alcohol reduction service at Be Healthy Bucks. So this is all about cutting back on alcohol consumption. It's not about quitting completely. It's just about harm reduction. And whether that's for health reasons, lifestyle changes, or just to feel more in control, it's something that our trained coaches can help with. We have one-to-one health coaching available for this, online group sessions, and to figure out which is the best pathway for you, we'll take you through an audit C and we'll figure out what to get you started on. This part of the service is not about judgment, it's just all about support. And you might find that the people that would benefit most from this service would be people that don't necessarily think that they're consuming too much alcohol. So if you do drink and you want to have a conversation with somebody about that and just reducing the amount that you are, get in touch and we'd be more than happy to help. 517 people attended an alcohol session with Be Healthy Bucks between January and March 2025. And then 205 of those people went on to reduce their audit C score. So they reduced the amount they were drinking quite a fair bit. So if you think that you'd be able to benefit from that part of the service, do come through and have a conversation with us. We also have our NHS Health Check team as well. So this is, again, a free, quick, confidential way to get a snapshot of your health. It's really for people that don't regularly access their GP surgery. So if you're an adult aged between 40 to 74 and you've not already had an NHS Health Check, just give us a ring and we can go through the criteria with you over the phone and get you booked in for one that's close to where you live. Similar to our other services, we've got clinics in all of the different districts across Bucks, so Aylesbury, Chesham, Buckingham, High Wycombe, and we're just setting one up in Amersham as well. The good thing about having a health check as well is it's not just come in and have your test done and then you go. You'll get to have a consultation with one of our health coaches, and they'll talk you through things like lifestyle, again, things like smoking, alcohol consumption, diet and physical activity, and give you advice based upon your results, or then refer you onto your GP surgery for anything more serious. And between January and March 2025, 310 people had an NHS health check with Be Healthy Bucks, and then 226 of those people were then referred onto different parts of our service. We get lots of really good feedback through Healthwatch Bucks, some really positive comments about different members of our team and things that people have achieved throughout their journey with us. And I think it's really important to shout about that. But if you're ever in doubt and you're worried about getting in touch with the service, if you pop onto the Healthwatch Bucks website, you can actually have a look at that sort of firsthand and get an idea of some of the ways that you could potentially benefit from coming through Be Healthy Bucks and having a chat with one of our team. And I guess just to finish up, the integrated lifestyle service Be Healthy Bucks, it's not just about getting you in and then getting you out. It's about taking you on that journey. And the way that we work is that it might be that you come through for an adult weight management program, but then 4 weeks in, you've gotten to know your coach well enough to have a conversation with them about your alcohol consumption. At that stage, we can then enroll you onto an alcohol program. And it might be that you're over the age of 40 and you've never had an NHS health check. We can then get you booked in for that. It might be you then have a friend that wants to stop smoking. We can then support them with that. And it's really giving that wrapped around care and offering that to every individual that wants to access the service throughout Buckinghamshire, just to make sure that, as mentioned at the beginning, that we're reducing health inequalities and starting to close that gap. And I should mention as well that the service is it's open to anyone that lives within Buckinghamshire, so has a postcode within the county, or is enrolled with a GP surgery in Buckinghamshire as well. And our support starts from the age of 5 and goes all the way up. So just get in touch if you do have any questions with those contact details on the screen.
Fantastic, thank you. That was a really interesting overview of the different, I didn't realise all the different aspects of the service. So that was great. Do you have to dress up in the cigarette costume, Owain?
Yeah, it's always me out in the cigarette costume.
We know how important these preventative services are when we talk to our NHS and social care colleagues. So I forgot to mention at the beginning, so we do have time for questions now, and I see Sarah's put a question in the chat, which I think you might have covered in one of your slides about the follow-up. So do you follow up post-end of programme to see if people maintain their weight loss?
Yeah, so we follow up at 6 and 12 months with individuals to check in.
And is that with all parts of the service as well?
Yeah, so we follow up with everyone that comes through the smoking part of the service, alcohol, family weight management, NHS health checks. Everyone that accesses the service will get a follow-up at some stage.
And do you, so I don't know if we saw stats in that, do we know how many people are able to sustain that?
Oh, I'm not sure off the top of my head, but typically the conversations, and this is just anecdotal, I can provide these at a later date, but typically people that use the service, it is sustained and they've maintained their outcomes. And if they haven't, it's an opportunity for them to come back through again. Yeah,
you mentioned that with the smoking service and how easy, how accessible you are for people who want to use it more than once. So yes, you can have a copy of the slides, Sarah. We'll send those out to you. And to any, we've got people's details, Fiona, have we?
Yeah. Yes, we do.
Okay, so if people would like those slides, if you let us know, we can send them out to you. But also this webinar will be available on our website in the next week or so.
Yeah. So there were a couple of extra questions that we've had in. So we had one question about self-referring think you spoke about being referred into the service, but can you just clarify if people can self-refer and how they do that?
Yeah, so you can self-refer to the service, and that can either be over the telephone, or you can access our referral form through the website and self-refer on there as well. And that means you can then book yourself into a clinic through the website as well.
Thanks, Owen. And that leads into the next one, actually, which is, do you have any drop-in sessions? And if you do, sort of, where are they and what do they do?
Yeah, so we've got lots of different drop-in sessions throughout Buckinghamshire. We've got a drop-in session in Aylesbury at Southcourt Baptist Church. We've got one at Chesham Youth Centre. We've also got one at the Hilltop Community Centre in High Wycombe, as well as High Wycombe Library. We've got lots of different locations where you can drop in, see one of our sessions, sign up, whether that's to adult weight management or for an NHS health check. And there is a broader list of those locations on our website as well.
Fab. Thank you. That's wonderful.
We've got another one. Sarah, what's the biggest barrier for the
again.
service? Sorry, it's good. It's helpful, Sarah. Thank you.
I think the biggest barrier for the service is getting it out there enough for people to know that it exists and what an integrated lifestyle service actually is. We get a lot of people that refer to us as the Stop Smoking service or the NHS health check service, and I think it's more about getting the message out there that actually there are lots of different things that we can support people with, and it doesn't have to be in any particular order. It could be at any given time, whenever that person's motivated to get that support.
Thank you. And so the family the weight management service, that you said that on the slide, that starts from for children from the age of.
So to attend a programme from the age of 7 up to the age of 13, but we can also provide some resource support to 5 to 7-year-olds as well.
Okay. And do you work with schools directly, or how do you kind of engage with sort of younger children and young people?
Yeah. So we've been working with schools more and supporting teachers in making referrals into the family weight management part of the service. But something we've been looking at more recently is actually running sessions in schools and offering it to more children. So that's something we're working on at the moment.
Yeah. Another question: do you work with special schools?
Yeah, we can. So it's all of our offers are inclusive. So we do also work with special needs schools. Yeah.
Okay. Fantastic. I see Sarah is typing. You've got any easy read literature?
We do have some for different parts of the service, but it's something we're working on at the moment to expand and to offer out for different parts of Be Healthy Bucks.
Yeah. Do you have those? Do you have contacts with the sort of special educational schools, or do you need sort of help with that?
It would definitely be something that we could use some help with linking up with more. It's not something we've had that much success with yet, but if you have any contacts, that'd be great.
Okay, yeah, definitely. We can think about that. Does anybody have any other questions? I can see Sarah is typing, but anybody else who's joined us? No. Okay, I'm just going to wait, see what Sarah says, and then if no one has any questions. Okay. Thank you. Thank you, Owen. That was brilliant. And we will, as I say, this recording will go on our website, and we know from previous webinars that we've done that it is viewed again many more times. So thank you for taking the time.
Brilliant. Thanks so much for having me.
Thanks very much.
Thank you.
Bye.
Thanks, everybody. If you have any questions, let us know, or if you would like a copy of the slides, then if you can just pop that in the chat, we'll make sure you get we send you those.
I'll maybe pop them on the website, Zoe.
Yeah.
Alongside the recording.
Yeah. Okay. Thanks, everybody.